Hey, this medication we're going to talk about right now, Lidocaine, also known as Xylocaine. If you've been to the dentist, you probably heard about this or had some of this right before your Novocaine. We're not giving it for dentistry. This is an antidysrhythmic. It's the type of antidysrhythmic. It's called a sodium channel blocker. Every antidysrhythmic has different channels that it blocks, a different class that it's categorized as. This is the sodium channel blocker. Now, what this does is going to suppress ventricular dysrhythmias by lowering this action potential. All right, we're going to basically slow things down. We're increasing our ventricular fibrillation threshold, but we're kind of slowing some conduction down through blocking those sodium channels that I told you about. When we give this, we can give it to patients in VFib or pulseless VTach. We can also give this to patients that have VTach with a pulse. Malignant PVCs can be medicated with lidocaine as well. When I'm not going to give this, I'll tell you when I'm not contraindicated for AV blocks. And think about it, many of our AV blocks, not all of them necessarily, but many of them already give me some slower rates to begin with. The last thing I want to do is be slowing things down. So not going to give this for AV blocks. Anyone who's sensitive to lidocaine or that classification of medications, want to be aware of that. Again, it might be the patient's first exposure to lidocaine. They might not know they have a sensitivity to it. So just again, clean sample history and do your continual assessment and monitoring while you're giving the medication. And we have some ventricular rhythms that aren't fast like VTach. We have an idioventricular or accelerated idioventricular rhythm. These are typically slower heart rates, less than 60. I really don't need to be giving this medication to someone in those Brady rates. Sinus Brady, don't want to give this. Also Wolff-Parkinson-White, that's a reentry type of arrhythmia. That's not going to be a benefit for that patient either. Some of the adverse effects, when I'm just going to talk about early lidocaine toxicity. Look, all these antidysrhythmics, antiarrhythmics, they work hopefully good for the reason we're giving them, but we can actually maybe cause some problems later on down the road. Kidneys and livers don't do well with a lot of these antiarrhythmics. As far as early lidocaine toxicity, you might start to see some muscle twitching, maybe a little disorientation, slurred speech, a little bit of altered mental status, maybe a sensation or feeling of pins and needles, that paresthesia, anxiety, apprehension possible, and maybe, again, a sign of early lidocaine toxicity might be a decreased heart rate. Late signs would be convulsions, hypotensive, and even a comatose patient. When it comes to my doses, really got a few different doses depending on the reason that I'm giving this. When my patient has ventricular tachycardia with a pulse, my dose is going to be 0.5 to 1.5 milligrams per kilogram. So it's going to be really important for me to do an accurate estimate of, I know that sounds weird, accurate estimate, but we're going to do an accurate estimate of the patient's weight because this is a weight-dependent medication. Again, VTach with a pulse, 0.5 to 1.5 milligrams per kilogram. I'm going to do a max cumulative dose when I deliver a total cumulative. In my call, I've given a total of 3 milligrams per kilogram. I'm kind of done with lidocaine. That's my stopping point there. It is packaged, by the way, it's usually packaged 100 milligrams in 5 milliliters. That's a pretty standard package that you have. All right, so I talked to you about the adult VTach with a pulse, 0.5 to 1.5 milligrams per kilogram. If I have VFib or VTach without a pulse, 1 to 1.5 milligrams per kilogram with the same stopping point of 3 milligrams per kilogram. Pediatrics can be used for ventricular tachycardia without a pulse. Pretty clean peds dose, 1 milligram per kilogram with that same stopping point of 3 milligrams. Another indication for lidocaine, kind of overlooked a lot. Yes, it's a cardiac med, and I just gave you some cardiac indications, but remember, we can give this as kind of like a numbing agent when we do intraosseous. So whether we're doing humeral head or down on the tibia, I can go ahead and flush with 20 to 40 milligrams, and that just might make it, look, it's going to hurt. IO is going to hurt, but this might just help take the edge off a little bit as we continue to give medication through that IO site. If we were to convert our patient, let's go back to our adult, let's say, with VFib or pulses VTach, and we got ROSC, return of spontaneous circulation. I might need to hang a lidocaine maintenance drip. Now that's typically 1 to 4 milligrams a minute. So we're gonna have to do a little bit of med math. The cleanest way to do this, this is gonna be weight dependent. This is just 1 to 4 milligrams a minute. Get 1 milligram of lidocaine, get a 250 bag, 60 drop set. We're gonna do a med administration drip as far as the med math box that we're gonna use. And we'll have some other videos out there to show you how to do some med math. But look, that's just some down and dirty on lidocaine. Fairly frequently used, or need to be able to recall this from memory. This isn't one of these sleeper medications that doesn't happen, you know, it's not like every couple of years this comes out. This might be one of your more common cardiac meds.